An aging committee meeting is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown. Here. Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
Great. Can we have a motion to excuse Councilman Schron?
Second.
Moved and seconded. All in favor say aye. Aye. Councilman is excused. Chrissy, has anyone signed in for public comment?
No, Mr. Chair.
All right. Can we have a motion to approve our minutes from the September 2nd, 2015 meeting?
Aye, so.
Moved by Councilman Miller, seconded by Councilwoman Brown. All in favor say aye.
Aye.
Minutes are approved. Well, we have two items on our agenda today and a presentation from the Cleveland Food Bank. And we're going to make a slight change, and we're going to allow the food bank to present first.
Good afternoon. It's really a pleasure to be here speaking to council today, and I see a lot of familiar faces and great friends in the room. So thank you so much for having me. I wanted to do three things today. The first is to give an update on hunger in Northeast Ohio and also in Cuyahoga County. The second is to talk a little bit about what the food bank is doing to address that issue in partnership with all of our collaborators and great other community organizations, including the county. And then the third is to talk a little bit about what's next. As some of you know, we've been going through a new strategic planning process and hit a milestone yesterday. And so I want to give an update and a couple of key strategies that we're talking about. So that we can talk about how we might be able to work on this together. I wish that when it came to having statistics and data on hunger, I had good news to report. Unfortunately, that is simply not the case. Just last week, new data came out that Ohio is 6th in the nation in the rate of food insecurity. We are 3rd in the nation in terms of very low food security, which means clients who are skipping meals, stretching meals, missing meals because they literally can't afford to put them on the table. From other data sources, we know, and we have known for quite some time, that 1 in 6 individuals in our 6-county service area are food insecure. That's about 327,000 people who are in need of help every year. And more than 200,000 of them, 241,000 of those folks, live in Cuyahoga County. The fact is that we are serving more people now than we were before the recession. At the Greater Cleveland Food Bank, through our network of partners, we provide food to clients who are up to 200% of the federal poverty level. But the fact is that about half of those client households fell below 50% of the federal poverty level. About 1 in 4 are above the poverty line, so in between 100% and 200%, and of course, clients up to 130% are eligible for the SNAP program, and that's something that we really focus on and work in partnership with the county to help submit applications. I frequently am asked whether or not things have improved at the food bank, whether we're seeing fewer clients now than we were before the recession. And unfortunately, that is not the case. We are serving more clients than we were, about 247,000 people a year. It's about 1 in 6 people in our community who turn to us for help at some point. And this is one of the big reasons. The fact is, in our state, 11 out of the 12 largest occupations didn't earn enough to put a family of 3 above 200% of poverty. Many people are working full-time, and they're working really hard at jobs, but in a job like a food preparation job, the average rate is about $9 an hour. And so if there's a single parent with 2 children at home, even working full time, they're still going to struggle and they're still going to be making very hard choices. And unfortunately, hunger has consequences. We know that folks who are hungry are more likely to struggle with other issues, including poor health. Last year we released the results of a huge national hunger study that we participated in. And for the first time, we collectively, in partnership with food banks nationwide, added some questions about health and more specific questions about health. And some of those results are here. One of the new questions was about diabetes, and we discovered that almost one in three households have someone affected by diabetes. And 61% of households have someone with high blood sugar. And both of these issues, as you know, are connected to the foods that we eat, and they make nutritious food all the more important. At the same time, more than 75% of households report that they are purchasing inexpensive, unhealthy food because it's all that they can afford. They know that they'd like to be eating more healthy food, but fresh produce is some of the most expensive product in the supermarket these days. And the less expensive product and food product fills you up, makes your kids happy. They don't complain about some of those things. Another issue that we have been talking a lot about this year and really trying to delve into, due in part to our strategic planning process, is senior hunger. I've been with the food bank for 15 years. Whenever we do a study, we look into how many of the clients we serve are senior citizens, and slowly but surely that percentage has increased over time. Now we're at about 16% of clients are seniors. But the number of senior citizens is skyrocketing. We've been having some conversations with the Western Reserve Area Agency on Aging, specifically around homebound seniors in need of food. And they shared this data with me just recently. Since 1980, there has been a huge population increase in the senior citizen population, and at the same time, federal funding has decreased significantly. And there are lots of challenges, of course, related to this, but one of the things that we know is that we are getting more and more calls in our help center from low-income, homebound seniors who are out of food. They are out of food. And we can sign them up for the SNAP program, of course, but they're homebound and they're not going to immediately have access to benefits. We can refer them to one of our food pantries or hot meal sites. But if they can't get out, the only way to get them food is to have those meals or those groceries delivered to them. And the fact is, most of those programs have waiting lists. And so, we've been in the situation a number of times where somebody in our help center literally can't find a resource for a senior who is out of food and homebound. And so somebody on our staff jumps in their car and they drive them food. But that's not the best solution. We need to have a better solution as a community. This slide speaks again to seniors, and it also speaks to senior health and the growing number of seniors who are making really hard choices, whether it's paying for food and paying for medicine, or paying for food and paying for medical care. And the fact is, making sure seniors have access to food is going to have a positive impact on their health in the long run. I mentioned that there are a number of things that we're doing. Some of you are very, very familiar with those already. I know that you've been out to see some of our mobile pantries. I know that you've all been down to our main community food distribution center on Waterloo Road. And the fact is, together, we believe that we can ensure that everyone has access to the food they need, but it really is an enormous community effort. Nothing that we do is alone. It's always in partnership. And in the 6 counties we serve, we are providing food for more than 800 programmatic partners, including those affiliated with the largest social service agencies in the region. As you all know well, we provide food to the agencies affiliated with the Hunger Network of Greater Cleveland, the Salvation Army, Catholic Charities, Boys and Girls Clubs, just about anybody or any organization who's involved in the fight against hunger is our partner, and they're getting the majority of the food that they distribute through the food bank. We also have some very creative programming where we work with non-traditional partners. Things like our mobile pantries, where we'll take a whole truckload of produce into an underserved neighborhood and do a mass distribution the same Wednesday of every month, for example. Councilwoman Conwell was just out at one of these distributions last week at Bethany Baptist Church. And depending on the site and the day, we could easily serve thousands, 6,000 or 7,000 pounds of produce at a small distribution to a few hundred people. And usually it's enough produce to last the week. We also have a lot of children's programs, after school feeding, summer meal sites. We had 87 this summer, and our Backpack for Kids program. And then finally, one area where we've done a lot to partner with the county and where we think there's potential to do even more is around our SNAP outreach program. We have a whole SNAP outreach team who's out in the community connecting with residents who are income eligible but not enrolled in that program. And we also have the only help center in the state, the only nonprofit help center in the state that is actually completing SNAP applications over the phone for submission. This year, we will submit 14,000 applications for the SNAP program, and the majority of those are to Cuyahoga County. As you can see, over the last few years, our distribution has grown, not just the distribution of food, but also the meals that have been made possible through this SNAP application assistance work. We know that for every SNAP application we submit, which is approved, more than 900 meals will be made possible to that household, and that folks are on that program for an average of 11 months. It's a critical resource, and that program also supports the local economy because those dollars are being spent right here with local retailers. We also have been talking a lot in this strategic plan about the fact that hunger is a symptom of another problem. There is a reason that someone comes to one of our food pantries for help. And it tends to be one of a few things. A number of months ago, we did a poverty simulation with the members of our board. And I think that for our board, and also for other groups we've done this with, we do it with the Leadership Cleveland class every year, it really is a great reminder of how hard it is to be poor. Everyone who participates in the simulation is put into the life, and they have the budget of a low-income family and needs to figure out how to make ends meet over the course of a few shortened weeks. And it's eye-opening because hunger is just one issue that families are dealing with. For the first time, we're doing an open poverty simulation, and it's coming up on September 29th at 8:30. And so if any of you have time in your schedule, you should have received information about it, but I think you would really enjoy and learn a lot through the experience. And it again, the folks that have done it with us, I think it really helps us all better understand the multiple challenges that folks are dealing with. Because the fact is there are a lot of different drivers of food insecurity. Folks are in line at a hunger center because they don't have the money they need to buy all the food they need, which of course would be everyone's preference, is that they were taking care of all of their own food needs at the supermarket. And the fact is, we also know that there are a couple of key drivers here. One of those drivers is housing issues. Another, of course, is work and income. Folks who are either unemployed, only partially employed, or employed full-time, but at a low-paying job. And then we see health issues on a very regular basis, clients who are choosing between food and medicine or food and healthcare. And so we've spent a lot of time considering these as we have gone through our strategic planning process. And there are a handful of strategies that I wanted to share with you. There are more, but these are the ones that I thought would be of most interest. And I share them early in this. We haven't done the implementation planning yet, but we're certainly open to ideas and to feedback. The first strategy is to continue to increase access to nutritious perishable foods, including more fresh produce. And this has been a priority for a number of years. But the fact is, we were able to advocate for additional dollars in the state budget this year to buy fresh produce from Ohio farmers. And we will have between 2 and 3 million more pounds of free fresh produce coming into our food bank in the year ahead. And so we'll be working with the community to identify new partners who can help us make sure that that produce gets out to the people who need it most. Our goal is that 85% of all the food we distribute is highly nutritious. And for this year, right now, we're at 90%. Another new priority is developing both programs and product types that serve a wider variety of food insecure audiences. And with a particular focus, I think, on seniors and the issue that I brought up earlier. We know that this population's growing, that people are living longer, that they're running out of money, and we need to make sure that low-income, housebound seniors have access to the food they need. And so the question is, how do we do that best? It may mean expanding the meals we provide through our community kitchen to other nonprofits that provide home-delivered meals, or it could take on another form. We are seeding a new senior grocery delivery program. There's one on the west side. We're seeding one this month on the east side. And we need to come up with more ways to work in partnership to get that work done. We also are talking about what we're calling shortening the line. You know, the way to fight hunger today is to make sure people have access to food at a community organization. The way to fight hunger tomorrow and to end hunger is by connecting people with services that can help them become more self-sufficient so they don't need to be in line. And so now that we've identified these 3 huge drivers, employment, health, and housing, how do we partner with other community organizations to make sure folks are getting connected to services? You know, we're not going to get in the housing business. We're not going to become a healthcare institution. There are plenty of very good ones in this community. But how do we work with them more closely so that clients might get food, low-income clients, if they go in for a health appointment, or when someone comes into a food pantry, they could have access to those other services, which will help them long-term. And I think that this is a new conversation that we're having at the food bank. There are a handful of agencies who are already doing this really well, but we need more of them if we want to ultimately shorten the line. And we want to make sure we're enhancing strategic partnerships, not just with our current network of food pantries and hot meal sites and shelters, which are critically important, but thinking outside of the box about other ways we might engage. So as an example, we know that 1/3 of the clients' households we serve have someone in them with diabetes. I was at a conference about a year ago talking about food as medicine, and they had a speaker from the Harvard School of Community Health. And they had done a study in California where they looked at low-income clients with diabetes, and they realized that their hospital admission rates skyrocketed in the 4th week of the month, increased by more than 20% every month in the 4th week, and they were trying to figure out why that was. And they finally realized that many of the hospitalizations were due to low blood sugar. One of the causes of low blood sugar is not having access to enough food, not eating what you're supposed to eat, and those low-income clients were running out of food stamps. And so, you know, the cost of a hospital admission, even a short hospital admission, runs in the tens of thousands of dollars. And an admission means there's a serious health problem, possibly, you know, something with a long-term consequence. So much less expensive to give low-income diabetics the right box of groceries and make sure that they've got that food so we can prevent that health complication, that health consequence of hospitalization. So how do we find partners where we can do this together and really have a positive impact on community health? And of course, there are many things we do with the county already, and many ways that we partner. And there are some things that, areas where we need your continued support. We know the budget time is coming, and the $1.1 million that you make possible annually to hunger programs is absolutely critical. The fact is, as you've seen, unfortunately, the need is only going up. And so we want to make sure that you understand the importance of those dollars and how much they mean to the clients and the programs that we serve. Last year, that $1.1 million provided 5.4 million meals through 33 Hunger Network agencies. And those meals are absolutely critical. We also want to continue to partner around the SNAP outreach work and helping clients submit applications for benefits. And then the last thing is, as we think about shortening the line and connecting with new non-traditional partners, we'd love to have your help in that work. If there are folks or organizations you think we should meet, that we should be working with, you are very well connected in the county and in the communities that you serve. And we'd love to have your help identifying possible partners. Other questions for me?
All right, thank you very much. Are there any questions from the committee? Councilwoman?
Through the chair to Christian, you had mentioned the produce, and I just wanted to make a comment, maybe like when I was there Saturday, it was eggplant. And not many people know how to prepare eggplant. So just a suggestion, maybe your staff or the students that work with you could produce maybe recipe cards for those vegetables that are not eaten regularly.
Absolutely.
You know,
Absolutely. It's critical.
That might help, because as the individuals go through the line, if they do not, they need it, but they skip over it, and they don't have to
Right,
take it
because they don't know what to do with it.
They don't know what to do with it.
Right.
So I just...
No, absolutely. Absolutely. We added a nutritionist to our staff a couple of years ago who does develop recipes and sometimes even goes out and does tastings, which is even better because folks can taste the foods that they're not familiar with. But with one nutritionist and 1,000 mobile pantries so far this year, she has a hard time getting everywhere. So what we're trying to do is encourage the agencies and the sites to print those recipes off our website. And I talked with the pastor there who was in charge of the distribution to let him know that those recipes were available. But we need to continue to spread that word, because you're right. If someone doesn't know how to use a product, they're less likely to take or to prepare that product, and eggplant's good for you.
And then my other suggestion, you had mentioned engaging other partners, and I was just wondering if you work with the Office of Homeless Services.
We were talking about this earlier, someone on our staff works very closely with the Office of Homeless Services. But I think that there are more partners we could bring in. I know the county's got a Department of Aging, and so we'd like to have some conversations there. And really, anyone who is interested in engaging with us, we would love to talk to, because we have a lot of food, and we got to make sure it's getting out to the right people.
And what about the Office of Reentry?
That's a great question.
Yeah, because a lot of individuals that get released, they need resources, they need food.
So right now, we have our outreach team actually going in to local prisons and doing applications for benefits that we then submit on their release date. So that it speeds up the process for folks who are coming back into our community, and there's less of a wait before their benefits go into effect. And that's something that actually has worked out very well. I don't know if you want to add anything on that front, Jamie.
I would say that, that's an area that we identified of a lot of opportunity, because obviously people are...
Jamie, come up to the...
Hi, I'm Jamie Sullivan. The reentry population is something that we have expanded our outreach to in the last few years. So when the outreach team is in the prisons, they're also talking about what other programs are in the communities where they are returning. We also go to prisons and facilities, correctional facilities outside of our areas because we know a lot of those people are coming back to Cuyahoga County. And the model that we have created is now being replicated statewide through the Ohio Association of Food Banks because they know that so many people are coming back here not prepared. But I think it's something that we're always, again, looking for more opportunities. But I think we're in all of the correctional facilities that are releasing to Cuyahoga County right now in Northeast Ohio. So,
Thank you.
I think that's an excellent idea, Councilwoman Conwell. We know so many people, there are food deserts, a lack of supply, but sometimes there's a lack of demand because people are used to eating the other things, those inexpensive McNuggets and fast food things. And once you see how the food is cooked and tasted, it certainly can help. So I think that's an excellent idea. Councilman.
Mr. Chairman, thank you very much for coming down and presenting. And my question is how many people in Cuyahoga County are on SNAP?
Oh, how many people in Cuyahoga County are on SNAP right now? Well, I know that there are 55,000 people in our 6-county service area who are eligible for SNAP and not enrolled in the program. And so that has been our target. I don't know off the top of my head how many people are enrolled in the program specifically in Cuyahoga County. You don't know. But the fact is we always want more.
Well, the next question would be what percentage of those eligible are on the program? So you were getting to that point where you mentioned the 55,000.
Yeah,
So that's a lot of people.
it is.
It would seem a high priority to get as many people as possible on SNAP.
Well, the fact is we know that it's a critical safety net program, that it is the program that provides the majority of the meals that low-income clients need, beyond the meals, of course, that they're buying themselves with the limited dollars that they have. And again, it supports the local economy. And so, with those federal dollars available, we want to draw down on as many of them as we can to support Northeast Ohio residents.
Is the SNAP benefit the same for everybody, or do you get more or less depending on your income?
It depends on your income, depends on your assets, depends on quite a different list of factors, and it varies widely. A low-income senior could get as little as, I think it's $16 a month, and a much larger family that's very low income could get a few hundred dollars a month. But the fact is it helps. And so enrollment, I think, is key. Our role is that we use the Ohio Benefit Bank software when we're out in the community and also in our call center to complete SNAP applications for clients. Now, that software also includes other public benefit applications. So we can do multiple benefit applications at the same time. And then we submit through an e-gateway to the county where that client lives. And so then that data, that application is already completed when it gets here to the county. Now, someone at the county, a caseworker, needs to have an interview with the client and approve the benefit. We can't approve the benefit, but it actually gets them submitted and gets their application complete. And we try to make sure that the client knows about that next step in the process, how they need to be prepared for the interview, what information that they need to have available so that we can speed that along.
And are people required to go to a personal meeting in order to get benefits? I thought there was an effort being made where it could be done over the phone.
Yes, now interviews can be done over the phone, which is a huge step in the right direction. Very important.
I also heard a report from the health department that by 2020 half of us are expected to be either diabetic or pre-diabetic. So the the whole thing about nutrition and health and bringing that into the program is extremely important, and I'm glad that you're working to address that, because we need everybody involved in trying to turn that around.
We absolutely do. And the fact is, with type 2 diabetes, that condition can be reversed with access to the right diet and with exercise. And so it is much less expensive for this community and better for our overall health if we can address those issues up front rather than treat the long-term complications down the road.
Absolutely. Thank you.
This is the Health and Human Services Committee, so this is something we all should be in this committee and in county concerned with. On a personal note, I'll tell you, I watch cable shows, so I've been just from watching these cable shows related to our food supply, and it talks about the corporate monopolies of our food supply. It's eye-opening to watch these things and the impact that it has, and the poor in our community, those living below the poverty level, they are receiving inexpensive food as a result of corporate control of the food supply. It's eye-opening to think the rest of the world, when it comes to poverty, they tend to be emaciated, but our poor in this country are experiencing overweight and health issues. So it's I don't know where you go from there, but it's a real issue.
It sure is. Well, and that's one of the reasons we've made distributing nutritious food such a priority, and why we've put such a huge focus on fresh fruits and vegetables. Because the fact is, the least expensive food, which is what you buy if you're on a very tight income, is also the worst for you. I used to give an example with my two small kids that, when I drove through the McDonald's drive-thru, it really made them happy. I mean, that Happy Meal did the trick. And it's inexpensive, and they liked it, and they didn't complain. And the fact is, when I put broccoli on the table, it's a whole different ball game, and broccoli is more expensive. Now, I can afford to buy broccoli and other fruits and vegetables, but not every family can. And so for a low-income single mom or a struggling family who's just trying to make ends meet, a box of mac and cheese or ramen noodles, they're cheap and they go a long way. And so these are the choices that folks make because they don't have the luxury of being able to buy food that's more expensive.
2 years ago, it's been close to 2 years now, the state cut back of food stamp eligibility for those who were able-bodied individuals. I know our county started strategizing on how we would address that. Maybe you can kind of recap from your perspective, what has happened over the last 2 years and what part you played in that solution.
Well, I'll tell you, that's been a real challenge because a lot of folks who previously, when we were taking advantage of the waiver as a state, were enrolled in the SNAP program, now are only enrolled in the program for up to 3 months in a 3-year period. And so what happens there is that, when they can no longer access SNAP, they turn to our network of emergency food programs like food pantries and hot meal sites, and it increases the demand at those emergency food sites. And so we continue to advocate to try to make sure that program is available to as many people as possible in our state because the need is still high. And when you see that Ohio is 6th in the nation in food insecurity and 3rd in the nation in very low food security, I think it sends a strong message that we need to bring in as many federal resources as we possibly can for whoever is eligible.
I'll throw out to you one thought that I threw out 2 years ago, that an able-bodied individual, one area of box checkoff that was underutilized was the self-employment box. And I know many who had small businesses, whether it was just a grass cutting business or it didn't matter what it was, but something that small, providing the proper documentation that's provided by the county,
Mm-hmm.
could allow someone to check off that box. So someone who could not, who might not have gotten the job interview or the job training or whatever the other options were, that was one that they could control their own destiny with.
Right. And one of the benefits of us having staff members who are helping folks complete the application is that they really understand the application, and so they can help provide a little bit of guidance in the event there is someone who's self-employed to make sure they understand that it's important that that be noted in the application.
Mr. Chairman.
Councilwoman Brown.
Thank you. My questions are, I think, relatively simple. What are the 6 counties? You mentioned we serve 6 counties. What are they?
That's correct. We go all the way east to the Pennsylvania line, so Ashtabula, Lake, Geauga, Cuyahoga County, of course, and then we also go south to Ashland and Richland counties. And the overwhelming majority of the food that we distribute and the clients that we serve, of course, are here in Cuyahoga County because this is where there's the most population. But we do provide services out there as well.
And they also contribute funds to support the
Yes.
network? Okay.
Yep.
And the last question, which I'm sure you can provide at a later time, but if you could give us a breakdown of the contributions from each county, is that something you can provide?
Now, I should say, when you say they also support, we fundraise in all 6 counties, but it's interesting, I don't know that we get public county support
Oh,
in all 6 counties.
all right.
So
Thank
that's
you.
something we might want to look into.
Thank you.
Yeah.
Councilman Miller.
Yes, are SNAP benefits subject to any time limits like cash benefits?
You have to reauthorize every 6 months, right? 6 months, Jamie? And the average length of time someone is on the program is 11 months. So, there is an ongoing process to make sure that you are still eligible for the program.
But there isn't any limit on how long you can be on it or many times you can use the program?
As long as you are income eligible and not in the status we talked about earlier, able-bodied adults without dependents, you should be able to be on the program as long as your income is still within the guidelines, which are 130% of poverty.
Any other questions from the committee? If not, Kristen, we appreciate it. Councilwoman?
If you could just, for the poverty simulation, you said 8:30, but you didn't give us when it would stop.
So it goes for a few hours. We'll probably go to about 11 or a little after. But it is worth the time.
And that will be located at?
That is at the Greater Cleveland Food Bank on South Waterloo Road.
Thank you. Do we need to RSVP or?
That would be great. Mary O'Shea is right here. She runs the poverty simulations. She's our director of advocacy, who I know that many of you already know. And she's going to be coordinating the events that day.
I'll shoot you an email.
Well, again, Councilman, go right ahead.
For able-bodied adults without dependents, what's the limits on the benefits?
3 months within a 3-year period. It's a time limit.
3 months within a
3-year
3-year period.
period.
Okay.
Do you have any statistics on the rise in numbers for, I guess, for the able-bodied adults that are now utilizing?
Certainly, that's data that we have that we can send you. The number of folks who've been pushed off the program.
Yeah, Cuyahoga County lost more than any other county in the state when the waiver wasn't accepted. It was 10,400 cases were dropped.
And obviously disproportionately people that are this reentry population, because the likelihood that they're gonna find a job is tough.
So we're still paying for it. The state said they're not gonna pay for it, but it still falls on the county taxpayers
Right.
to.
See, I saw an opportunity for 10,400 small businesses.
I will say really quickly,
When the ABOD waiver was rejected, we did meet with folks at the county and put together this one sheet about all of the opportunities that people could become exempt. And obviously that's one of them, exemptions from the waiver. And we sent it out through our network of 800 member agencies and programs so that they could distribute them at our pantry so that people would have access to that. But it's a good reminder that we should do it again. So
The county small business development is handled, we contract with ECDI. They may be worth becoming one of your partners as well to assist in some way.
Great. Thank you.
All right, if there are no further questions, Kristen, again, we thank you and the entire team for, again, just keeping us abreast on things going on with the Cleveland Food Bank.
Well, thank you for your support and your partnership. We value it very much. It's critical.
Okay, thank you. All right, Chrissy, if you read our first resolution.
Resolution 2015-0188, authorizing a contract with the Salvation Army in the amount not to exceed $527,499 for the past transitional housing program in connection with fiscal year 2014 Continuum of Care Homeless Assistance Grant Programs and HEARTH Act for the period 10/1/2015 through 9/30/2016.
Good afternoon, Ruth Gillette, Office of Homeless Services. This contract is funded 100% through the Department of Housing and Urban Development, HEARTH Act. The fiscal year 2014 award provides renewal funding for the past transitional housing program operating cost. PASS accommodates 75 men at a point in time. In a 12-month period, the program served 206 unduplicated individuals. 7% of the clients were veterans. 132 individuals exited the program. Of those who exited the program, the average length of stay was 6 months. 76% moved on to permanent housing in the community. 52% left with employment income, and 90% had accessed non-cash benefits for which they were eligible, like food stamps and Medicaid. The contract was approved for an RFP exemption on August the 10th. The operating start date is October 1st. If there's any questions, I'd be happy to answer them.
Any questions from the committee? No questions. Rather routine. Yeah.
Okay.
After a while, we have seen enough.
Well,
All right.
come back every year.
Yes. Well, I'm going to make a recommendation that we approve this resolution under
That would be
first
great.
reading suspension.
That'd be awesome.
Second.
Moved and seconded. All in favor, say aye.
Aye.
Ayes have it. Thank you. Chrissy, if you read our next resolution.
Resolution 2015-0189, authorizing a contract with Emerald Development and Economic Network in the amount not to exceed $1,443,960 for administration of the fiscal year 2014 Shelter Plus Care Sponsor-Based Rental Assistance Program in connection with the HEARTH Act Homeless Assistance Grant Program for the period 8/1/2015 through 7/31/2016.
Again, Ruth Gillette, Office of Homeless Services. Again, this contract is funded 100% through the Department of Housing and Urban Development fiscal year 2014 grant award process. It renews existing funding, maintaining rent subsidies for chronically homeless individuals with severe and persistent disabilities. 93% of the grant dollars go directly to support rent subsidies. The subcontracting agency, Eden, may use up to 7% of the award to verify client eligibility, conduct housing quality inspections on units, issue the rent checks to property owners, recertify individual clients on an annual basis and reinspect units on an annual basis, and to maintain documentation at the agency of program compliance with HUD regulations. In a 12-month period, the outcomes for the contract included that it served 228 unduplicated households. This is more households than are actually being funded by the grant, and that's because not every client requires a 100% subsidy, and so the grant is able to assist more than just the funded amount of people. 22% of the individuals served were veterans, and the reason that the percentage of veterans served is so much higher for this grant is that veterans are disproportionately represented among the chronically homeless population. So that's why there's such a high number of veterans that are served. 97% of the clients maintained their housing for longer than 6 months, so people are very stable once they've moved into a Housing First project. Of the individuals who exited the program, 75% moved on to permanent housing in the community. Less than 2% returned to shelter. 71% of all participants received cash income, which means that they, even though they are on disability, they're receiving disability income and may be receiving some other sources of income, part-time employment after some time that they've been there. And 89% of the participants received non-cash income. So again, every effort is made to connect people with the benefits that they're eligible for. And 67% of the participants increased their income from the time that they entered the housing. So again, helping people access benefits and income is an important aspect of the Housing First project. The contract was approved for an exemption on August the 10th. It has a contract start date of August the 1st. Of September the 1st. What does it have? August the 1st. This is late because it's a combination of reasons. One, due to HUD issuing the grant award notice late, and then just the normal kind of county contracting requirements and multiple steps. So,
Mr. Chairman.
Any questions, Councilman Miller?
Did the lateness of the contract prevent any services from being provided, or was there enough money left over in the previous year's contract to fill the gap?
To the chair, to Councilman Miller, it did not delay services being provided, rent being paid. Eden has a line of credit, and so they were able to exercise a line of credit for the month of August and September. And then once the contract is approved, and we'll be able to go back and reimburse them for those expenses.
Because of this late start, it would seem that it would help if we pass it under second reading suspension. Would that be helpful?
That would be very helpful.
Okay.
Thank you.
Councilwoman?
Through the chair to the director, could you give us a reminder of why these two contracts are on an annual basis again?
Because, to the chair, to Councilwoman Conwell, these are part of an annual competitive grant application process that we submit to the Department of Housing and Urban Development. The Office of Homeless Services submits what's called a consolidated application, and some of the projects the county's the applicant for, as in these two, for example, and then other agencies are their own direct applicants, but the Office of Homeless Services is required by, HUD requires that there be a single application, and the office has fulfilled that role since 1995. So that's why we come back every year, because every year HUD approves it, and then we have to go through the whole process again.
Thank you. And then there's an open house coming up for Corsica Avenue. How does that, that's part of Eden. Who is going to be housed in there? Is that housing for some of the our homeless individuals that we have in the community?
To the chair, to Councilwoman Conwell, in fact, that's housing through a different project funding that they receive, and I did receive an invitation to that, and I'm drawing a blank on if it's an 811 project or what the funding source is. They also manage property for the Adams Board. It might be through the HAP, the Housing Assistance Payment Program. It's not a continuum of care project.
Okay.
I don't think. Sherry, is it? It's not. No, it's not.
Okay, thank you.
All right, if there are no further questions,
I'd like to make a motion to move this to the full council, second reading suspension.
Second.
Moved and seconded, all in favor say aye.
Aye.
All right.
Thank you very much.
Is there any miscellaneous business from the committee? Not. We have Mrs. Liu, who is signed in for public comment. Ms. Liu, please come forward.
Thank you to have me again. Here I have individual letters to present to you. May I approach?
And you can give it to the clerk.
And Homeless Congress was very happy that our council lady, Conwell, actually graced us with her visit. And she really listened and she took lots of notes. But that was already like 2-3 months ago. And we have been through some other meetings and trying to open more of the channels for communication, which we have done. But the thing is, the problem has been on for too long. For the problem to get solved in a short time, we know it's not very possible, but it seems that some of the parties are not very enthusiastic to put on more efforts as you have did, for example. You have done that. So we really would like to have a real hearing. In that case, the Homeless Congress, the people, homeless people, and service provider and other partners, we will have equal chance to really discuss things face to face. Because in the past, even, for example, council lady came to the meeting, listened to us, but there are other interference. Then, so later when the council lady had another meeting with service provider and other people, we were not asked to participate. So lots of people were very disappointed because certain things, they think it was not really addressed properly. That's why right now, Homeless Congress had a meeting this month, and we really wish to have this hearing so we can all have equal opportunities to really raise a voice and to have a true discussion on the fair ground. And I hope this will really address the issue better to the public, to let everybody knows what has been going on, truly going on. And we really have to seek resolutions because the problem has been on for too long and lots of people have been hurt. I mean hurt, harmed during this process. Being homeless is already very unpleasant. Then while you are struggling with this issue, you have to struggling even more issue while you are already homeless. This is really not right. Thank you very much.
Thank you. All right, if nothing else holds our attention, our meeting is adjourned.
Okay.